go. Yep. Hey everybody, this is Dr. Warren from Kalkstein Chiropractic in Towson, Baltimore, Maryland. We are today here with Kaylee, and we're going to be showing you how I examine a low back. We were just talking in the hallway about something that's bugging her, and I got a little bit of a history with her prior to the video, so I'll spare us the time and just kind of fill you in a little bit. History of gymnastics for 13 years. She gets bilateral low back pain. Sometimes it's right, sometimes it's left. It's usually with increased activity. Lunging position, lunge with twist is what really sets it off. And then relative to prior care, she's had a brief stint, maybe 2 visits of chiropractic care, which were not helpful in the long run for this problem, maybe in the moment. And then relative to the symptoms, she's just started getting that a little bit more recently because she's working a little bit more on her feet. And then, does the commute bother your low back at all?
Sometimes.
She got a 45-minute commute getting here, right? An hour. So she's a chiropractic assistant with us. She graduated from
Limestone University.
That's right. And you played what?
Field hockey.
That's right. Field hockey. And field hockey there for 4 years.
Yes.
Yeah. And so you played a sport where you're in a position of basically kind of like a split lunge, if you will, the whole time. Actually traveled with the Colgate field hockey team recently, and I was watching film over the coach's shoulder, and I was like, well, collegiate field hockey is legit.
Yeah.
High school field hockey is not so legit.
No.
Not that there's not legit players out there, don't get me wrong. But I'd watch growing up, my sister played, and so I'd watch her play lacrosse, and it was competitive around here. Baltimore is like kind of a lacrosse hub, if you will. And then field hockey's not so much. But then you have these random players that are really exceptional when they go off and play college ball. And so I was watching, I was like, oh, it's fluid. There's a little bit of a tempo to it. It was good to watch. So I digress to coming back to your low back and your kind of history coming in. 4 years of college sports, and then she's the exercise science track at school, is that right?
Health science.
Health science, is that kind of similar degree? Towson's got the exercise science program. And then you're kind of in this transition period over the next year or so as you're getting your feet on the ground, saving up some money, figuring out, do we spend all this money on grad school, holy loans, figuring out what you're passionate about, figuring out what fields are out there. So the practical experience in the United States is kind of backwards. We do it at the end of school, where other schools really intertwine it early on into post-grad and trade schools. So coming into, over the next year, looking at PT school, looking at chiropractic school, looking at nursing, looking at a lot of different things, and I'm just grateful to be a part of your journey as you get you make that decision. Truly, yeah. So her low back, right? And so she's awesome here. She's a great asset to the team. Really grateful to have her on board. Hard worker, is always there to help me out when I need something, as well as patience. So it's a huge asset to the team. I'll make sure she's feeling good, and I'm gonna show you how to examine the low back. All right, cool. Kaylee, come on over here towards me, face me, hands down by your side. Good, and relax. Are you doing the stair climb this weekend?
No, I haven't signed up. Sorry.
Yeah, you should. All right, so the copay for this treatment is going to be you signing up for the stair climb. All right, bend to your right for me. So there's a 9/11 Memorial Stair Climb in Baltimore this weekend. We'll send this video to Luke today. We'll put it out there. Come join our team. There's 4 of us signed up. Me. Scarlett, my 2-year-old, Tanya,
and
Elizabeth.
That's it.
Wait.
Me.
That's right. And then you, come join us. Carly might be coming. What's up, Carly? Welcome to the team. I'll bend to your left for me. Okay, then come back up and then go down towards your toes. I'm just doing general range of motion assessment, looking at posture, looking at how she moves, seeing if she's tighter on one side in the hip, when she was on that right side. Come back for me here. Good. Any pain at all when you get into that position?
Just tight.
Okay. I'm just going to feel how the end range feels to the joints when I'm kind of motion palpating, as well as doing a Kemp's orthopedic test. So although it's just like a, hey, does this hurt here test, you can get a lot out of it from how she does it and where she hurts when she does it. She's got a little something right there going on relative to it being a little bit stiffer, that's for sure. Go ahead and take a seat here for me. Stand back up. I want to do a Storks Test. She has a history of gymnastics. A lot of gymnast players have facet-related pain or pain of the joints, and something called spondylolisthesis is a really common thing. It can be symptomatic or not. I'd imagine that this might be symptomatic for you. Put your right leg like this. Good. If you need, you can use my hands. Okay. And then bend backwards for me. This like hyper isolates the left side of your lower back. Come back up and then switch. And then we're going to do the right side. Here's my hand if you need it. Okay, you failed the balance test, that's okay. Any discomfort going on either side with that?
This feels tight. It doesn't like hurt. I can just feel like my back arching, if that makes sense.
It does, yeah. Just some pressure building up.
Yeah.
That's totally normal.
Yeah.
Okay. Come sit here for me. I wouldn't do reflexes on a patient like this relative to where she's having her problem. She's not having any neurological symptoms. And truthfully, I wouldn't really do any muscle testing. And she's not having nerve-related symptoms, so I'm not going to do any neural tension testing. This feels like and sounds like and moves like a really functional-based problem that kind of comes back to the same area over time. And the history of the sports might play into it a little bit, but what can we control about that except for just knowing it? And so if it's functional, I can move you, I can do some things to treat the tissues and make it feel better, for sure. I'm good at that. And our team is good at that. I've got a feeling already that the movement side of care is going to be a huge focus for her, and how she stabilizes her low back. So I watch her move all day long because she's alongside me as we're doing stuff. So I already know that how she balances and stabilizes her spine is very back dominant, right? And that's a normal thing to do because it's such a strong entity, and we can lean on it for support in so many ways. And after a little while, it starts to be like, all right, find a new routine because this is getting old, right? That's a really easy, concise way of saying you're overstressing the facet joints of your low back when you move. Okay? And so let me take a look at your hips and your low back. I'll palpate a little bit more. But I already have an idea in my head, watching her move, hearing her history, and going through this problem so many times that I'm going to lean into some developmental movement type exercises, DNS, some exercises that we learned over the weekend. And then we're going to talk about routines to see if we can strike a balance between all the volume you do here and what you do outside here. Straighten this leg. Toes to your shin. Some people will just watch these videos to watch treatment. They don't get that with me sometimes. I talk a little bit during them. So if you want to fast forward to minute 12, you can just go ahead and do that right now. Good. Anything in the back with that?
Just like here.
Just a pull in the butt on this side?
Okay. Right here.
Let's do that again. Do it on your own volition, and then just come down for me. Let your head fall at the bottom. Good. And I'm kind of shortcutting the slump test on that. Anything with that?
Just a stretch hamstring.
Yeah, nothing in the spine, right?
No.
I don't think that's going to show up. Come on your back for me here. 9/11 Memorial Stair Climb. So we got 5. I'm going to do 5 more adjustment videos today. I'm going to see if I can get some other staff members to join up. Relax, Carly. You want to come join us? It's a great cause. It's a really awesome event relative to who it supports. And they do a good job of just kind of bringing back some respect to that day, as well as some mindfulness of what we went through on 9/11. So it's a cool event in that sense, and it also supports the family of fallen firefighters currently, right? Not just from 9/11. Good. Your hip range of motion is impeccable. They have great internal and external rotation. No abrupt feeling when I scour the hip as I'm pushing down and feeling the back of the capsule or loading different points of the joint. Everyone has a lot of pressure built up there. If you don't, then you don't have an internal kind of immediate hip capsule. But that was good. You felt great.
Yeah.
So I'm going to do the same thing over here. So when I had you flex forward, there was just a little more resistant to the front here.
Yeah, I had what was it? Junior year, 2 years ago, I had like groin issues in this one.
Oh.
But it's like I took a week off or something. But it wasn't like, it just comes and goes sometimes.
Yeah, okay. Kind of like your back.
Yeah.
And so I'm just feeling how the joint's moving relative to side. She has a little more tension right here relative to this side here. And then when I close down, I feel it bound up a little bit more, relatively speaking. And then I'm just going to see how you bring this knee to this shoulder without moving your low back. Stop. Good, come back. Do it again. Stay at this angle, right? Hold on. Right here, go ahead. Pause. Good. Do it again without moving this bone underneath my thumb. Go ahead. Focus just hip, 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 hip. Right there, you see how it kind of drops away?
Yeah.
Don't let that happen. Okay. So it's not easy for you to do it, but it's possible. It's just you're kind of running out of space the way that you move your hip, if you will. So I'm going to look at that as well. I'm going to feel your low back and move your hip back a little bit, okay?
Yeah.
My treatment plan for you is we have different levels of hip exercises. We have foundational movements called McKenzie stretches, McKenzie exercises. We are predominantly trained in McKenzie's. There was an artist on Spotify when you came into the office the other day, and that was playing, and it was the most obscure name of an artist that you picked up right away. Who was that?
I don't remember.
Oh my gosh.
Was it me?
It was you. Yeah. So is that any discomfort or pain when I press here?
Not really.
Okay. Any pain or discomfort here?
No.
Okay. How about here?
No.
Good.
When you let up, I can feel it like here.
And the hip itself here?
Yeah.
Okay. Alright, so we do these foundational movements for the joints relative to trying to isolate the problem area. So it's diagnostic as well. It tells me when to start loading a person relative to how they're responding to it. These are McKenzie stretches. She's going to do hip McKenzies. She's going to do take-home hip exercises as well. Hip level 2, which is a little bit more focused on not explosive but challenging strength exercises around the hip, complex movements, compound movements. And then I'm going to move your mid back here a little bit, okay? Mm-hmm. Relax your shoulders. Good. Let it all go. Good. Keep breathing. Cool. Easy. Good. And this is where you kind of hold it, if you will, okay? So let that go. Good. Let it go. And then we're going to dry needle. You don't want it?
I don't care.
No, I don't think so. You laughed, that's all. We're going to dry needle just these trigger points that I'm finding on her at L4, L5, the multifidi. We're going to work on her glute med right here. I might look into her anterior capsule a little bit with her TFL, but it doesn't feel like where the majority of the problem is coming from is anterior capsule. And then her hip flexor, her psoas. We're going to work on the edge of the psoas muscle through here. So she's going to get adjusted. She's going to get soft tissue work here. We're going to do dry needling in this region, if you will. And then I'm going to start to push her on the exercise floor to start to change how this complex between her low back and her right hip and her hips in general stabilize and move. So we're going to get stronger in her core. We're going to change up her hip a little bit as we work on it. Okay? All right, relax your shoulders. Good. Go. So you're going to lie on your side, this side up for me, okay? Normally I would have an assistant in here help me out, but my assistant is literally on the table. So I don't want to pull too much from the office right now, but I'm going to show you generally speaking what I do on the psoas muscle, on glute med, just for the tenderness, and then how I adjust her low back. So rectus abdominis. This is your fascia that connects your transverse abdominis and your muscles of your spine, your QL and your lumbar erector spinae to this tissue. There's also fascia coming in from your external and internal obliques that mesh into the side here. There's something called the lateral raphe that sits right here. It's oftentimes tender right there on people that have some hip or low back issues going on. Relative to why that tender point exists, honestly I don't know, but I see it quite often, and I remember learning about it in anatomy, and it was something that was a clinical pearl shared with me by somebody in school. But this is the edge of the psoas muscle. Bring your knee to your chest. That's quad, psoas. So at the very end, the psoas is contracting, and that's why you probably felt my fingers a little bit more towards the end of that motion. There's the edge of the muscle, that's on top of it. I'm gonna work towards it, putting compression on it. Try to give some sensory feedback to it, just so it can loosen up a little bit, okay? Mm-hmm. There it is. Okay, I'm gonna hook your foot with my foot. Okay. Good, reach your hand over your head for me. Good. Bring your knee to your chest. Good, and relax, let it fall.
I think I have an issue with making myself relax. I don't like to relax.
And the rest of America. Relax. Easy. Well, here's your practice time for it. You got 5 minutes in your day. You're committing yourself to relaxing a little bit. We could all use that a little bit more. Whether it's on a chiropractic table or on a yoga mat or whatever. Relax here. Maybe not. Like I don't know. Is Netflix and sitting on a couch count as that relaxing? I don't think it does.
No.
I don't think we're being mindful. We might trick ourselves thinking this. There you go. Back up. Oops, good. Okay. Straighten your leg. Bring your knee to your chest. So. There's a lot of different ways to relax muscles and trigger points. Dry needling is something we do. We do radial pulse, which is like a percussion type treatment that I'll show you about later. ART, pin and stretch, is another one that we do quickly and effectively in an area. I like that a lot. That's been very helpful for me playing lacrosse and doing things in the past from a sporting standpoint. So, a recovery standpoint, I should say, from injury has been really helpful for me. A lot of soft tissue injuries, tremendously so that I learned it when I went to school right away. Okay, a lot more pressure. So now I can get a little bit more depth. Bring your knee to your chest. Good. Okay. I just let this leg sit right here for a second. Carly, I'm gonna come where you are. Oh, no, I got you. Are you clocked in right now?
Yeah.
I don't know. Relax your shoulders here. Good. Rest. Breathe. And exhale. Okay, a lot of movement for me. Good. Back. A little more oomph. Come on your side, face this way. Okay, this side is a little easier. So, the majority of my pressure is right around her sacrum where she needs movement, in my opinion. Let this go. Good. Come on your back. Relax. Okay. Little hip distraction. Relax the knee. Good. Nice. Little trigger point there. Okay. Feel a little pressure. Good. Loose. There we go. Good. Alright. Dry needling, exercises. We'll get to that in another video because we got to get back to work. Introduce you to Kaylee. Welcome back, everybody. Thanks to Carly, we are back on the show, back on the channel. Thanks for watching. Welcome back. We did an adjustment earlier today with Kaylee, and we were examining her. We're showing you kind of a pretty straightforward range of motion orthopedic exam on the low back. And then when I was motion palpating her, working on her lower back, her low back joints, and you can kind of remember from the exam, they move really well. So what do you do in a case like this where you have a case where someone is very mobile in the lower back? So for pain, what we often do is we can adjust in an appropriate spots. So a little bit more the junctional areas for her, definitely the sacrum, SI joints, L5, S1, lumbar segment 5, sacral segment 1, we can dry needle for the pain in the areas on trigger points, areas of tenderness, and for her case, this is really right by the lower lumbar spine near the PSIS, the top of the ilium, sacrum. So you're going to feel a little sensation right there. Okay, Kaylee? The biggest thing we're going to do is we're going to focus on a stability-based program for her core and her low back. Just the fact of loading her spine in a neutral position with different forms of weight training is going to be our next step with her, right? So at lunchtime when she's taking her breaks, we're going to get her on a nice good program so that she can get a good 3 to 4 months of solid weight training done, alongside getting some passive modalities like dry needling and adjusted, and if we need to do a little ART and soft tissue work. So you've heard the term, maybe if you're going through the process of getting treated for something like this, of hypermobility. Sometimes people have this diagnosis of EDS. She does not have EDS. She doesn't fit the kind of qualifications for that. Or instability, lumbar spine instability. Those are just kind of loose terms to say, hey, this thing isn't really tight through here. There might be some sensitive spots in certain areas and some trigger points in certain areas, but it's not necessarily the joints of the lumbar spine need to get adjusted. So we're going to focus on a stability-based program, but I'm also going to adjust certain areas in the mid-back and in the sacrum and SI joints and focus on getting some strength in here. All right. How's that sound, Kaylee?
Great.
You game?
I'm game. I have time.
All right. You got to make a decision right now. Where you going?
Going where?
I don't know. You tell me.
I was trying to tell you earlier. I was looking into chiro schools.
Okay.
But I don't know what I wanted. I don't know.
That's the point of looking, right?
Yeah. Yeah.
Keep looking. Keep talking.
I started looking into it once I heard about all the people coming in here being like, I don't want to do PT, and I realized that I like the hands-on aspect versus just sitting there watching them do exercises.
Mm-hmm.
So I started looking into chiro schools. And then when I was talking to you about sports chiro, there was a couple of schools that had it, but
getting a master's degree in sports.
yeah, like doing the doctorate for chiro and then taking like the electives to be certified for sports.
Yeah, so I'm certified sports chiropractic physician, CCSB. I did that credentialing afterwards. It's good. It has that credentialing component to it, but it definitely doesn't, like your application to your, like even if you were to go to PT school, to be honest with you, or osteopathic school, you can be the best adjuster in town or manual therapist in town. It's just your application. So like what I usually say to people is, all right, let's look at the scope, let's look at the availability. Sometimes PT schools, they want you to have like 3 years of experience before they let you apply. It's just a demand thing.
It's hard to do that.
Doing okay with this?
Yeah.
You were worried a little bit, but it's not bad, is it?
No, it just, sometimes it feels like a little pressure, like that one.
Yeah. So that's, remember I was kind of poking on you right there. I said if you had anything, it'd be right there.
Yeah.
What I find is that people that have a little bit better mobility respond super well to dry needling, and they actually enjoy it a lot more than, say, someone like me, where it's just like, it's another level sometimes for me when I get it done. So you're good.
Yeah. It doesn't hurt right now. It just feels like a lot of pressure in like certain spots.
That's those spots usually are the areas that respond well to the needling and provide a little bit of that relief we're looking for. All right, she'll lay here for 10 minutes. You can see she was pretty chill there. She might fall asleep. She's been working all day, so I wouldn't be surprised if she did. And then I'll come pull these for you, okay?
Yeah. Sounds great.
Cool.